Hi everyone, and welcome to this very special and highly anticipated episode number 6 of Ask a Biller. This is all about how to navigate insurance as an out-of-network provider. As always, I'm Dylan from your favorite SimplePractice billing service, Smart Billing Pro.
And I'm Maggie. I'm an insurance specialist here at SimplePractice, and we are super excited about this episode, and not just because we get endless customer questions about billing out of network, but because we have a really awesome guest segment that was put together by our friends at Better, which is a really awesome company that we partner with, and they help your clients get reimbursed at no cost to you.
In today's video, we'll cover the following topics: how out-of-network benefits work, courtesy billing, balance billing, Superbills, and lastly, we'll address the questions that you've been sending us for the last 5 months.
So let's get started by understanding how out-of-network benefits work for your clients. The first thing to understand is that not all plans have out-of-network coverage. If your client's plan is an HMO or an EPO, they do not have out-of-network coverage and will not be reimbursed for your services.
Plans that will likely have some kind of out-of-network benefits are PPOs and POS plans, but always be sure to check with the payer first. Next, out-of-network benefits are usually totally separate from in-network coverage. This means that if your client has a deductible with their contracted plan, services that they pay for that are out-of-network will not go towards the in-network deductible. If the plan that they're on says they have a deductible that needs to be met before the payer will reimburse any services that are out of network, it's usually separate from the one that they're paying for in network. Again, that means there's 2 entirely separate levels of coverage.
You may come to find that with a lot of out-of-network coverage is sparse. Additionally, payers will not reimburse clients based on your private session fee. Reimbursement is based upon what is called an allowed amount. And that is the value of the service given by the payer based on what they deem as appropriate to charge.
That means that your client's coverage could say that for out-of-network services, they'll be reimbursed at 50%, and let's say your session fee is $100. Naturally, you would think that the client would be reimbursed $50 for the service. However, that's not the case. The payer will reimburse off of their allowed amount, and in this example, they believe the service to be valued at $80, so they will reimburse the client $40.
Many clients might not understand the intricacies of out-of-network coverage, so it's important to be knowledgeable and set realistic expectations regarding reimbursements.
That being said, there are a few options for how you, an out-of-network provider, can choose to navigate insurance. The first option we're going to go over is courtesy billing.
So courtesy billing is when you're not contracted with an insurance payer, but you opt to file claims on your client's behalf. This is a good option to relieve your client some of the stress they might face trying to understand how to submit clinical information to a payer.
Many payers will allow you to courtesy bill electronically, but you're going to want to call the payer first because there may be some required paperwork to submit before they'll start accepting your claims.
In this scenario, most providers will charge their client the full session fee upfront or will make other arrangements to determine what the client is responsible for. And filing their claims is really just a courtesy. Payers will usually reimburse the clients directly. Because you don't have any kind of contractual obligation to this payer, there's no expectation that they will send the payments to you.
To make sure that your reimbursements are sent to your client, you'll need to check box 27 on the claim form to not accept assignment, also known as send the money to the policyholder and not you.
Another thing to keep in mind is that the payer is usually going to send reimbursements to the plan's policyholder, usually in the form of a check made out in their name, regardless of who the patient is. So unless arrangements are made ahead of time, this is important to consider if, let's say, you're working with spouses going through a divorce or children that are covered under their parents' plan that they don't live with.
Payers are reluctant to send payments to anyone other than the person who they're contracted with. And in this scenario, the policyholder or the person that signed up for the coverage is the only one that they have a contract with. And here's a little Smart Billing Pro tip. The best way to handle this is to collect your full fee up front from the client and let them know they can keep and cash the reimbursement check. Expecting them to bring in and sign over the checks to you gets difficult and confusing fast.
So the next term that we're going to go over is balance billing. And this refers to billing your client the difference between your full session rate and the payer's allowed amount. Let's say your session fee is $100, the payer deems the session to be worth $80, and that your client owes you $40. Charging your client the $60 difference is an example of balance billing. You can only balance bill if you are an out-of-network provider. Payers on insurance panels are bound by contract to only charge the agreed-upon amount.
All right, next up, our partners at Better are going to tell you everything that you need to know about Superbills, otherwise known as insurance reimbursement forms.
Hi, I'm Kelly, and I'm a billing expert at Better. I'm here today to talk about how our company works with SimplePractice to get your clients paid back by their health insurance. If your practice doesn't take insurance, a correctly formatted Superbill is the fastest and easiest way to get your clients paid back. Better and SimplePractice are experiencing a high demand from patients who pay out of pocket for care and want to get reimbursed. So, if your practice doesn't take insurance, you need to understand the importance of Superbills. I want to talk about how much we love SimplePractice Superbills. In your SimplePractice toolkit, there is an amazing Superbill. We love it because it contains all of the necessary information needed to file claims on behalf of your patients. So what is a Superbill and why is it so important for getting your clients paid back? A Superbill is a document that outlines all of the care you have provided to the patient and contains all of the information they need to file a claim. SimplePractice providers can find the Superbill right next to their invoice. So, when is the best time to give a patient a Superbill? You should be giving your clients a Superbill every time you give them a receipt for their care. So, what goes on a Superbill? First, we need basic contact information. That lists your name, address, and contact information so that the insurance company knows how to reach you. Second, we need your EIN number. EIN stands for Employer Identification Number. It can be described as a social security number for businesses and identifies your practice. If you don't have one, you may use your social security number instead. The National Provider Identifier, also known as the NPI. An NPI is a 10-digit identification number that has been adopted as the standard provider identifier. Most providers have one because it allows them to work within the insurance system. An NPI is optional, so if you don't have one, it's okay. Fourth is the date of service. A Superbill must show the date of service for the appointment. It can be a single appointment or many appointments. Fifth is the diagnosis code. This code is a tool used to classify symptoms, diseases, diagnoses, and all other patient interactions. It helps the insurance company identify the care you have provided. The final item is the CPT code. CPT is a coding system used to define medical, surgical, and diagnostic procedures. There is a code for each procedure performed, specified by a 5-digit number. We love SimplePractice Superbills. They have all of the necessary information we need to file claims on behalf of your patients. According to SimplePractice providers, their patients love using the Better app too. Next, I'm going to show you how easy it is for a first-time user to submit a SimplePractice Superbill using the Better app. They start by signing up or logging into the app. Press the button to upload a Superbill, take a picture of their Superbill, and then click Submit and upload it to their profile. After it's done loading, we take care of the rest. It's that simple. The key takeaway is that with the proper Superbill, the turnaround time for reimbursing your clients is much faster. So that's it for our first video in partnership with SimplePractice. I hope you enjoyed it. We certainly had fun making it. If you have any questions about Superbills, using Better, or want to receive brochures for your office, please contact us at support@getbetter.co or download our app at www.getbetter.co.
Awesome. Thank you so much to the team at Better for stepping in to explain Superbills. So the last thing that we're going to do is cover some of the questions from our community. These are questions that we've collected over time and saved specifically for this episode.
How can a counselor in private practice file for out-of-network benefits/payments? How can the private counselor know how much to charge for the deductible?
Hi, Tracy. Yes, any licensed counselor in private practice can at least attempt to file for out-of-network claims. Of course, that doesn't guarantee that the services will be eligible for reimbursement. You can verify the client's coverage ahead of time, but you may run into issues calling the payer for this information. Payers are less inclined to share benefit information with providers that aren't on their panel, so your safest bet is to charge your client your full session fee for whatever you're comfortable charging per session, and waiting for the first claim to be adjudicated to determine if their plan processes the service.
Can I use a database such as Navinet or Availity to verify benefits if I am out of network?
Lori, that's a good question. And the answer is yes, you can use Navinet or Availity if you're already set up with either. However, we recommend being cautious when giving these benefits to clients. Sometimes the out-of-network benefits aren't super comprehensive on those services.
If you're submitting a claim as a courtesy for an out-of-network client, how do you indicate that the claim was paid in the claim list?
So currently, the SimplePractice insurance payment page is set up to account with in-network insurance payments in mind, meaning that some parts of your full session fee is discounted or written off, so claim statuses will update to paid automatically only when you enter a payment from the insurance and account for a write-off and client payment. If you're courtesy filing and you're not writing anything off, you'll want to have your client's billing page set to self-pay and charge them the full rate for the session or whatever you decide to charge them for those sessions. So in this scenario, those payments from the insurance should be going to your client, so you shouldn't have an insurance payment to record. Therefore, claim statuses won't update to paid, but the client also won't be accumulating an insurance balance.
Do I have to enroll with Florida Blue if I am out of network and am going to reject the assignment?
Hi, Susan. The answer to your question is no. You don't have to file an enrollment through SimplePractice, and that's because Florida Blue Cross Blue Shield doesn't require enrollment for claim filing. Enrollment requirements vary by payer, so keep in mind that some payers require that you submit some documents to them before they will accept your out-of-network claims electronically. This process is handled outside of SimplePractice. For more information on that subject, check out episode 1 of Ask a Biller, where we talk about enrollments.
Is there a way to opt out of automatic payment reports from an insurance company?
So that's a great point, Jenny. And yes, you can opt out of automatic payment reports. Automatic payment reports are especially beneficial for in-network providers that bill exactly how the insurance processes their claim. But if you're out of network and setting unique session rates and write-offs that differ from what the payer says, they may not be super helpful for you. If you're currently receiving payment reports that you don't want, please send in a support request through our help center and one of our insurance specialists will help you get that squared away.
All right, that's it for today. Thanks so much for tuning in to this episode of Ask a Biller, and thanks again to the folks at Better for contributing an awesome segment this month. We'll see you all again on July 19th, where we will be hosting a live Q&A. Remember, you can get updates and see all the past episodes on our YouTube channel, so make sure to subscribe.
And remember, if you have questions that are specific to your SimplePractice account, take a look at our help center at support.simplepractice.com and browse through some of the live support classes that we offer. And until next time, keep it simple.